Hello, I'm Shelena,
And I'm Alex.
and this is another episode of Why I Left Bedside.
And here we talk about burnout, going from burnout to breakthrough. So today's episode is all about our lives at the bedside as nurses.
So we're gonna start off first by this is gonna be called like our cancer awareness segment. So we're just gonna share a few facts about the cancer of the month.
So since it's November, the cancer of the month is lung cancer. So it is Lung Cancer Awareness Month. Know the facts and take action. What is lung cancer? Lung cancer starts in the lungs and can spread to other parts of the body. It's one of the most common and deadliest cancers, but early detection saves lives.
Types of lung cancers: you have non-small cell lung cancer. 85% of cases often linked to smoking, but can occur in non-smokers. Small cell lung cancer: 15% of cases grows and spreads faster, strongly tied to smoking.
So there's several risk factors, and some being named are smoking, which is the main cause, secondhand smoke, radon gas exposures, asbestos or workplace chemicals, air pollution, and family history.
All right, next. Show your support by wearing white or pearl in November. Share facts and stories to raise awareness and encourage. All right.
So now we are at our bag of the day segment. We both like to shop. You can catch us in Marshall and Ross, which we like to call Marshall Raw, all the time. And so let's get into the bags. So, what do you have?
I have this bag, this cute little bag that kind of match my shoes, but this came from Shein.
And I have a True Religion little crossbody. Yeah, let me tell y'all something. I'm True Religion damn bad. Like when it comes to a bag, if it's True Religion, I need to have it. It feel like anytime I go on a Ross, Marshall, TJ Maxx, it feel like a scavenger hunt. Like I feel like I'm going on an Easter egg hunt. So when I find a new one, it's just I don't know, it give me a little rush. Like I get a little adrenaline rush.
Yeah, I be trying to get all the True Religion bags.
Yes, like I got a collection.
Where we love to shop at?
Marshall Rock.
Where we love to shop at?
Marshall Rock.
Where we love to shop at?
Marshall Rock.
Now we move on to our main segment, Life at Bedside. So, what drew you into nursing?
What drew me into nursing? Well, first let's start off because I originally did not want to be a nurse. I wanted to be three different things. I wanted to be a pediatric cardiologist, a dentist, a veterinarian.
Okay.
So, growing up, I say about 11 is when my dad is a diabetic, and so when I was 11, he had to get a toe amputated. And so I was there, at bedside with him, just when he was getting things done to him, and that really just, I don't know, it drew me in. I'm like, okay, they do a lot. And as I grew up, he was sick and out of the hospital, due to amputations and diabetes. And then eventually his kidney function declined a little bit. And so just seeing how impactful nurses were, the care, the hand in hand care, the hands on deck, I just loved it because I wanted to be involved. And then I remember him getting sent home with a pig line. And I used to ride the bus, and I would get off the bus, and he used to have his pig line flushed every day. So, baby, I took that job serious. When I got off that bus, hand hygiene, let's wash his hands, and let's flush his pig line. But I took that job so serious. I said, you know what, this is what I'm going to do. I'm going to be a nurse. Because my daddy was sick. They took good care of my daddy. I'm going to be a nurse. And this is what we're doing. What drew you into nursing?
Kind of similar story.
Okay.
But first though, I love kids. I used to always take care of all the kids. I always babysit all my little cousins, from a baby to as they got older. But so I thought I wanted to be a neonatal nurse
Mhm.
practitioner. But going through nursing school, I was like, I don't know if I want to work with babies. It was just so much information, and it just seemed more critical than working with the adult. Um, but my grandmother, she was a bad diabetic. She's passed away
Okay.
now, rest her soul. But I used to have to get her insulin injections, and
Okay.
she would just let me do it though. Like she could give it to him herself, but she would let me do it. She'd draw it up, and then I just
Mhm.
stick her. At 6 years old, I'm just sticking.
Oh, 6.
Yes,
Oh, wow.
it was crazy.
And there
Didn't
was a
know.
lot of trust you had, baby.
Yes,
6.
didn't know nothing about subcutaneous tissue, but I was poking. But yeah, that what kind of led me into nursing. I'm just a big person. Well, I'm big at caring for people. I love to care. If I don't know how to do nothing else, I know how to care. I care for you.
She cared.
Yes,
She cared.
a lot.
And even from the heart.
Yes, it
If
does.
you ever, like, if you needed a friend, this the girl to go to, but she got too many now. So, yeah.
Yeah, I got a lot of friends. Um, but yeah, so that what drew me in, and she died like before my high
Mm.
school graduation, like a few months before. So I just felt like I wish I would have known more about the body
Mhm.
before she passed away, because maybe I could have kind of helped prolong her time here on
Mhm.
Earth. But I didn't. But I made myself learn more about diabetes, of course. Diabetes
Wow.
will change your life.
Mhm.
Yeah,
Yeah.
it's yeah. But okay, so what was your experience like at the bedside?
My experience at the bedside. Um, it. Hey, I feel like bedside is what you make it for the most part.
Just to explain about what bedside is a little bit more. It's basically just consider as working in the hospital, nursing home, any of that critical like setting. I wouldn't consider a clinic to be bedside because
Acute care, really,
yeah,
more so.
mainly
Yeah.
acute care, and then long term care.
Yeah.
But you having that patient for a couple of days, and you're caring for them, carrying out, their care plan, and you just with them every day. You're on the floor doing everything you need to do to care for them. That's really it. It's mainly just med surge, just
Hospital
working the floor.
setting,
Yeah, hospital setting.
nursing home, like you said.
Mhm.
What else? Long
Mhm.
term acute care. Um, it's bedside. So
Yeah.
we're literally bed in the room. We beside the bed, bedside.
Mhm.
um, so my experience working bedside, like I said, it's what you make it. But also it can be what administration makes it. It can be what
Mhm.
the patient makes it.
Mhm.
Because
Family
it's
member
some,
make it.
yeah, family members is,
Doctor make it.
yes, yes, it's so many components. So I coming into nursing when I was a baby nurse. I don't consider myself a baby nurse anymore. Um, when I was a baby nurse, I feel like bedside was terrifying,
Mhm.
terrifying because I was just so scared. Like, oh my god, like I. What am I gonna do in a cold? Just like, what if this
Mhm.
happened? What if this happened? What if this happened? What if this happened? But I learned to just go with the flow. You
Mhm.
have everything that you need.
Mhm.
I I was prepared. I graduated nursing school. I passed the NCLEX. I'm prepared, and I have people with me who are prepared, who seasoned,
Mhm.
with seasoned nurses, and so I felt like, hey, my coworkers are seasoned, they got my back. So
Mhm.
if anything goes down, I'm asking questions. Ask
Mhm.
those questions, y'all.
Yes.
Ask
Ask
questions.
questions.
I'm asking questions.
That can save a
So,
life.
oh yes, never hesitate because you are scared to ask a question or just you shy. I mean, I was shy too, but it's not about shy or being an introvert or anything at this capacity because you have somebody's lives in your hands. So
Mhm.
I would say never be scared to ask a question. But I can't say that working bedside was intimidating at first, but as I grew comfortable, um, it became second nature, really. Um,
Yeah.
because I love my patients. I have compassion for my patients. I want the best for my patients. I want to give them 100% of me every single time I step on the floor. And so, with that in mind, coming into work, I was like, okay, I'm ready. I'm ready to go care for my patients. Let's do this for 12 hours. I can do anything for 12 hours. I'm ready to care for my people. But on the other hand, when I don't have enough staff support, I don't have enough support period from administration, that can be very discouraging. That can be intimidating. Um, it's just when you're short staffed, it's a little frustrating because now I don't have a PCT, so now I have to be the PCT, the janitor, the mechanic, the just everybody. Um, and however I can do your job, you cannot do mine. You cannot think, for my patients and do what I do for my patients. And so, I feel like that part became very frustrating to the point where it's like, okay, no more, no more, because you don't care, and if you don't care, what happens to me?
Right.
When my life is on the line and something happens to my patient, when I've got one jumping out of the bed, and I've got one needing pain medicine, and I've got one that's going down, that's crashing, and what I mean by crashing is vital signs are probably not appropriate or what they need to be, and they need some more attention, and I can't get them that because I'm having to wear 20 hats at one time. That's when bedside became, I don't want to say a burden, but
Mentally
when I went
draining.
yes, mentally draining. But when I went to work, I felt burdened to the point where I didn't want to go to work, and that's not how I came into the profession.
Right.
Because when I came into the profession, I was very happy. I was excited. Let's go work. I'm ready to go work. I'm ready to change lives. But then it's factors like that just made bedside draining. So I would say overall, my experience at bedside, I can't just pinpoint one adjective, one word. Um, I would say it was good and bad.
So, y'all, to explain what a PCT is, that's basically your CNA.
Patient care technician.
Patient care technician. So, yeah, got your CNAs, they're licensed. Then I think most hospitals call your PCTs, they're not licensed, but they're doing the same thing. But yeah. Well, my experience with bedside, pretty much the same, but I love what I do. I enjoy what I do, but it's just when you're understaffed, you're wearing so many hats, and you can't really do your job adequately to take care of your patients and give them the care that they really need because you wearing so many hats. And it's just like, I just feel like it's not enough people around us that supports us and on the floor that's able to help us because all the other nurses, they have, their workload as well. It's not enough manager support. It's not enough supervisor support. It's just not enough support in it all. And I feel like we need that. We really need more support there with us because the job is very demanding. It's very demanding, and it takes 100% of us to do what we can for the patients to put them in a better health than what they was when they came. But I love bedside, I do. But just right now, it's time for a break. It's
For
done
sure.
came very frustrating and just mentally draining at this moment. But yeah. So, what's the high points versus challenges?
Okay. High points. Getting to see a patient when they enter the hospital and when they go home because they're better. They came to the hospital sick, but now they're better and they're ready to go home to their families and just continue life as they know it rather than being inside of a hospital. Challenges, just I feel like hmm, so many.
Yeah.
So many challenges. I feel like beating yourself up because you feel like you didn't give your patient the care that they deserve because you were doing so many different things. It had too many responsibilities to where you couldn't.
Yeah.
And then also having too many patients Six to one is too much, by the way.
It
Six to
is.
one, what I'm saying by 6 to 1, you're having 6 patients assigned to one nurse. And so that one nurse, and I know there's facilities that may have a 7 to 1 ratio,
Mm-hmm.
and I've even heard of nurses saying an 8 to 1.
Yeah.
I don't understand how that is humane, but hey. But just having too many patients and not being able to be in a room for the time that they need, because like I said, you got somebody's crashing, somebody's jumping out of the bed, somebody,
Mm-hmm.
somebody need pain medicine, and I just can't get to everybody. Also a challenge I feel would be maybe having a cold and your patient didn't make it, and so you feel guilty, cuz like what could I have done different? What could I have caught?
Yeah.
Like what didn't I catch? What did I miss? So I feel like that's a challenge.
Yes, it is.
Um, your high points versus challenges.
My high point is just hearing the patients say, really thank you, honestly, being very appreciative of the care that I've given them, just putting a smile on their face, changing their whole mood,
Mm-hmm.
and just making them feel better. That's my high point because that's what I'm here for, and I just love the care and help people be better. Um, a challenge is basically the same thing, wearing too many hats, just having so much to do when you can't spend the adequate time that you need to spend with your patients because they really need all of your time, but you have all these other patients that need your time as well. And it's like, I really hate I can't be in more than one places at one time
Mm-hmm.
because I just try to do as much as I can, and it really weighs down on me when I can't do what
Mm-hmm.
I need to do, or I can't give them something like I be in the patient room and they ask for a cup of water, and I got 50 of them other things to do, and it done been an hour or two
Yeah.
past, and I done forgot to give them that water, like stuff like that, like.
Yeah.
And there's nobody else that you can really ask to give them a cup of water because everybody's so busy.
Yes.
So yeah, this a challenge.
And I feel like to kind of piggyback off of that and being in other rooms and having to do so much, and that cup of water, like to the patient, it is
Mm.
such a big deal. To me, it's
Yeah.
a big deal.
Yeah.
But I I don't want to say they don't understand, because some of them are not informed or don't know that,
Yeah.
you know um there's a lot of other things that's going on, and you don't tell your patient, hey, I got other patients, I got it,
You care
because
for 'em, yeah.
you never tell them that,
No.
because it's patient-centered care overall, and so it's about them.
Yep.
But then we also have to go through a list of priorities. I got somebody that's vital signs don't look good. I need to talk to the doctor. But you've asked me for water, and then bed 3, they need some pain medicine. So after I talk to this doctor about these vital signs, I need to go get this pain medicine, and then I can get this water. But on the way to get the water, I got a patient that done fell.
Yep.
So now I got to call a fall alert, and I can't get to you. And you've asked for water probably 3 hours ago. And because we don't have a PCT to help to do vitals or to anything, we don't have a PCT period,
Or just an extra person.
an extra
Period.
set of hands,
Yep.
no secretary. So
Yep.
you don't get this water until especially night shift. They'll probably be asleep by now. I go in there 12 o'clock, you're asleep, and I got this cup of water for you.
Yep. That you've been asking for 3 hours ago. Yeah.
And that makes me feel so bad, so guilty. But how do we help that?
Yep.
How
And
do
say that patient had to be NPO at midnight. It's like, dang, that was their last cup of water they could have drunk before the day shift.
and NPO 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 means nothing to eat or drink by mouth, and this NPO is very typical for patients who will be having a procedure the next day. So they'll be NPO after midnight, or someone who maybe had a stroke or has some swallowing difficulties, and is at risk for aspiration. And aspiration is when you kind of swallow some water or some food and it goes to your lungs, which can be very deadly.
Yeah.
So that's what NPO is.
Okay.
Let's see.
It's game time.
Yay.
All right. So this game is called Most Likely To. Nurse edition. So we're basically just gonna pick from this cup again, and we're gonna point to whoever we think most likely does this or that.
Okay,
All right.
let's do it. Uh-oh. Uh-oh. I had some technical difficulties.
Okay. Most likely to have a drawer full of snacks. I think that's both of us.
Um,
You think more me?
I feel like I have a water on the bedside or something to drink,
Mhm.
water to snack.
Well,
But
that's
you
what I have.
snack-
Like at home in the bed, that's what I have. My drink. But I
If you
don't
snack, you
really
stay
drink
with a
it.
snack.
But I do stay with a snack if I'm not in bed. I just don't
This the
wake
snack,
up in the
like,
middle of the night just to eat anything. I don't do that because I sleep throughout the night.
if I need a snack at work, this who I go to.
But when
Cause
I'm
9
up,
times out of 10, she got some popcorn, she got some peanuts, she got something that I could get. So,
because I be hungry, y'all. Every 2 hours, I'm ready to eat something.
all right,
When
most
these eyes are open,
sorry.
my stomach open too. I'm ready to eat.
Most likely to get lost in the hospital hallways.
Ooh. I think both of us. Somebody be calling me when she have a place to go in the hospital that she ain't been before, or done been but
yeah.
forgot.
Hello, where's blood bank? Yeah,
And I be like, ooh, I forgot.
yes. I'm gonna use my resources. I'm gonna ask that question. Ask that question.
Ask
Ask that
y'all.
question. Thank you.
Most likely to stay late just to finish chart. Hmm. Yeah, I got to finish my chart. I don't care how late I care how late I stay there, but I gotta finish the chart. I gotta finish the chart, y'all. Finish your charting, please. Charting is all your documentation, everything you did for that patient. You just make sure it's charted.
Cause if it's not documented, did it happen?
Nope.
Oh yeah.
Did
So
not
cover your
happen.
tails. CYA. Most likely to survive a zombie apocalypse using only nursing skills. I feel like that's you because me, I'm freaking out. And I'm gonna be, Shelena, what we gonna do? What we gonna do?
Okay. Well, I guess so, because I can be a little calm in kind of hectic situations.
Is that the last one?
Is it the last one? One more on them.
Oh, no, that's the last one.
Most likely to sing at sorry, most likely to sing at the nurse's station. It's both
of us. We're
Both
gonna
of
render
us.
you a selection.
From the Muscadine Mass Choir.
Oh yeah, we the Mississippi Muscadines, by the way. Thank you.
All right, y'all. That's it with the game.
Yes. So bedside shaped us in so many ways, but it also came with challenges. Next week we'll talk about the turning point, the moment we started to think about leaving bedside. So we will see y'all next week. Thank y'all for being tuned in, listening to us, watching us, wherever you get your podcast from. Thank you, and we'll see y'all next week. Bye.
Bye.